Hello, my name is Catherine Dolan, and I am the Elsevier Health System Sales Executive that supports the state of West Virginia. This is a brief presentation that will hopefully provide you with an overview of how Elsevier supports nursing organizations like yours, but more specifically, how our solutions address some of the burdens that y'all are facing today. Nurses are, in my opinion, the rock stars and ultimately the superheroes to healthcare. Unfortunately, being a superhero doesn't come without challenges. And these are some of the challenges that we understand your profession is facing today. We conducted an internal study here at Elsevier, and we learned that more than 50% of new to practice nurses are unprepared for practice. 43% of the time, they're struggling with clinical judgment and patient management. They're also struggling with time management and stress management, which we believe is why almost 24% of new RNs are leaving their first job within 12 months of joining an organization. As a result, hospital systems are suffering financially, and so are patient outcomes. The average cost of turnover for a hospital is between $3.6 million and $6.5 million a year. Just 1% change in RN can cost or save an organization more than $270,000. So we understand that you need to have absolute confidence in the resources that are chosen to support your nursing teams, their careers, and their day-to-day, minute-to-minute decisions. So let's talk about why the top 100 health systems in the country trust Elsevier and the evidence-based content that we provide. Elsevier is trusted based on three different things: the depth and the breadth of the content that we offer, the consistency and evidence across all of our solutions, and last but certainly not least, our mission to support nurses throughout their career journey. Elsevier has been providing medical content to health professionals for over 140 years. We've adapted the delivery of this content to best support our clients. Our nursing portfolio empowers nurses to provide safe and standardized care with the evidence-based information all the way from education to professional practice, starting with our nurse residency tools that support professional practice, clinical reasoning, confidence, and more. We also at Elsevier partner with leading associations like AACN, ASPAN, ENA, ANPD, and so many others to offer clinical e-learning to orient new nurses, transitioning nurses, and this also promotes professional and leadership development. You may know our MOSB, our clinical skills as MOSB, which are still the best and support education, competencies, offer CEs, and we now offer a new technology where skills seamlessly integrate into the EHR for point of care. Clinical Key for Nursing houses all of our primary nursing literature, journals, textbooks, drug monographs, and more. Care planning guides the nurse during that patient interaction, and our patient education platform makes delivering this information more meaningful for those patients that are leaving their care. Healthcare organizations use our portfolio of clinical nursing solutions to simply promote clinical excellence and safe patient care. If you remember only one thing from this presentation, please remember the consistency and the quality and the evidence that we do provide. Every single piece of evidence that goes through any of these solutions goes through this process of the Internal Shared Governance Council, editorial board. We work with subject matter experts. We have an advisory board. The single editorial team assures that if there are care variability initiatives, that we truly support that, because the evidence that's provided from product to product, solution to solution is consistent. Elsevier is forward-thinking and bridging the gap from education to practice, which is why we offer solutions to support novice nurses and resources that continue to help them grow throughout their career. The portfolio empowers professional practice, clinical competence, and the opportunity to learn and grow as a nurse leader. There's a lack of exposure and experience in the clinical setting that new nurses have before they begin working to care for patients. Evidence has shown us that not only do new nurses believe that they are unprepared and not ready for professional practice, but nurse educators and other leaders believe that there is a significant need for more training and education for their novice nurses. Recently, the director of nursing programs from the ANA summed this challenge up by stating, "We can't graduate nurses fast enough, but even when they do graduate, they are often not prepared to provide the level of care that's most needed right now." The key focus here is that we at Elsevier are focused on supporting the training of new nurses, again, throughout their entire career journey. So what can we do at Elsevier today to help you with this first and foremost challenge of not enough nurses, but the ones that we graduate aren't prepared for practice? We start with transition to practice and shadow health simulations. These two resources combined provide your new to practice nurses with experience and exposure, and really to hone in on those professional practice skills, clinical reasoning, and clinical judgment. If you aren't familiar with these solutions, please explore how we can help your transitioning nurses to being confident and competent nurses and ready for care at the bedside. The resources are evidence-based and ultimately help those new nurses feel like they're practicing in a safe place, but they also provide feedback directly to those that are educating or mentoring them during the orientation time. And last, but certainly absolutely not least, we are very proud of the Elsevier Healthcare Hub. This is our contribution to the healthcare community, and it's really it includes access to COVID-19 information, behavioral health, mental health, obesity, and more, those epidemics that we are facing as a healthcare community today. This is my contact information. Thank you so much again for listening to this brief presentation on how Elsevier can help support your nursing organization. And again, what we can do immediately to help your new to practice nurses feel confident and competent. My contact information is on the screen, and you can see the information for the COVID Healthcare Hub, as well as the overall healthcare hub that we have that includes all those other topics just covered. Thank you so much, and I hope you have a wonderful conference.